In this video, we will demonstrate how to perform a proper arterial examination. After introducing ourselves to our patient, we will begin with a general examination, observing the patient, examining the skin color, and raising the lower limb to see if there's any color change. We inspect between the toes to check for any lesions, scars, or abnormal findings. We also have to check the skin temperature, comparing both legs and arms for symmetry. Now we check capillary refill time. This refers to the time it takes for blood to return to the capillary bed after applying pressure. Capillary refill time should not exceed 2 seconds. We now proceed to pulse examination. We start with the radial pulse, located lateral to the flexor carpi radialis tendon. Medially, we find the ulnar pulse. In the anterior part of the elbow flexure, we locate the brachial pulse. And finally, the axillary pulse, which lies beneath the insertion of the pectoralis major and deep to the humerus. We have to explore all pulses bilaterally. Next, we assess the carotid pulses bilaterally, located anterior to the sternocleidomastoid muscle. And the temporal pulses, located at the temple, anterior to the auricle. We also have to use the stethoscope to listen for any roots, which may indicate carotid stenosis. After, we palpate the aortic pulse, assessing its size. A prominent pulse may indicate aneurysmal dilation. We also auscultate to detect roots, which can suggest mesenteric, renal, or aortic stenosis. We will continue with the examination of the lower limb pulses. We begin with the dorsalis pedis pulse, located on the dorsum of the foot, between the tendons of the first and second toes. Then proceed to the posterior tibial pulse, found below the medial malleolus, between it and the Achilles tendon. Next, we assess the popliteal pulse, located on the posterior aspect of the knee, with the leg slightly flexed. Finally, we palpate the femoral pulse, positioned inferior to the inguinal ligament. We assess the femoral pulse bilaterally, like the others, and auscultate for any roots suggesting stenosis. We show you a more enlarged image of the pulses that are most difficult to find. The ideal position to palpate the posterior tibial and pedis pulses is by placing your hand in a C shape, as it provides you more stability. In some patients, it may be useful to force dorsiflexion to facilitate palpation of the pedis pulse. We are providing you with a diagram with the reference to locate the pulses we have examined. Now we'll perform a series of specific maneuvers to identify various vascular abnormalities. For Adson's test with the patient seated, we stand behind them. Place one hand on the radial pulse and abduct the arm to 90 degrees. We rotate the head in the opposite direction. The test is positive if the radial pulse diminishes or disappears, suggesting compression of the subclavian artery and brachial plexus as they pass through the scalene triangle. The Allen test assesses the compensation of the palmar arc, useful before placing a radial artery line or dialysis access. We ask the patient to open and close their hand several times. Then we compress both the radial and ulnar arteries. After a few seconds, we ask the patient to open their hand and release the ulnar artery to observe if color returns, indicating sufficient blood flow. We repeat with the radial artery. Now we go for Eden's test. We maintain the same position as Adson's test. After locating the radial pulse, we externally rotate the arm. With the free hand, we lower the shoulder. We ask the patient to take a deep breath and hold. A positive test occurs if the radial pulse decreases or disappears, indicating possible costoclavicular syndrome due to compression between the first rib and clavicle. Finally, we explain the right test or pectoralis minor maneuver. With the patient's radial pulse located, we abduct the arm to 90 degrees and externally rotate the shoulder. We control the trunk and scapula with our free hand. The patient is asked to turn their head to the opposite side. Diminished or absent radial pulse suggests compression of the neurovascular bundle by the pectoralis minor. To conclude the video, we have outlined some key aspects to consider when examining pulses, including the presence of the pulse, its frequency, rhythm, amplitude, hardness, celerity, meaning the speed of each pulsation, the quality between pulsations, shape, and their symmetry. For example, when assessing the radial pulse, ensuring symmetry between the right and left pulses. Thank you for your attention, and we hope you find the video helpful.